Hi everyone, I am Dr. Sharat Babu from Warangal. I am a refractive cataract surgeon practicing from the past 30 years. This is my 30th year of ophthalmic practice. So I started my practice here with the SICS and then FACO. And then my first multifocal I operated is in 1998. That's a diffractive IOL which I put. Once this trifocals era has come, after the extended depth of focus of IOLs, I was a fan of PanOptix IOL. I should mention this. Then an IOL, a trifocal IOL by name Optiflex Trio. I went through the details of the IOL and then I happened to implant in one of my patient whom the other eye was operated by a different trifocal. And the patient is so happy, and after that, I never looked back. In my practice presently, most of my trifocals are from this Optiflex Trio. I tried these lenses on different category of population. Once I started with the housewives, then the professors, then the software people. And surprisingly, this is more suitable for everyone. All the patients whomever I implanted this IOL, they are so happy. Their intermediate vision is good, their near vision is good, and the ease of implantation is really excellent. The injector is a dual injector. You can rotate it, you can push it. This is something really good. It's not just the rotation or the pushing it, but the IOL is placed in such a way, it goes through less than 2.2 mm, just slips inside and then just goes inside and then slowly opens up so that you have time to replace it, to position it into the bag. The post-operatively, you can see almost nil cells in the antechamber. It has got both the spherical and even the toric trifocals. So I compared the rotation stability of these IOLs and it is recorded as less than 3 degrees. The long term I've been implanting from the past 1.5 years. The long term effects also you can note, like there is no posterior capsule thickening in these patients and I didn't have a chance of giving any air capsulectomy for these patients. You have the availability of the lenses of different powers even for myopes and even for the hyperopes. When you compare the contrast sensitivity, it is really good and the patient's experience, especially in the while driving and also the night vision is excellent. Thank you.